to know that I am going to start recording this session, and it will be available to you on the CBS Student Services website, or you can contact me for information about how to access these slides, but it will be made available to you. There are many, many resources that I'll be sharing with you today, and you will have an opportunity, like I said, to ask some questions toward the end of our presentation together. You'll see in Zoom that there is a Q&A section, and I encourage you to enter your questions there. And then toward the end of my time giving you some information, I'll go over those questions and give you some answers. So today, what I'll be talking about, here we go. Okay, is just first of all to share some events that are happening this week with you. So today is going to focus on how to become a competitive applicant for health professional school, and I'll mostly be focusing on medical school, dental school, and also pharmacy. But tomorrow we have another event called Maybe Medical School, Maybe Not, and it's exploring careers in healthcare that are a little bit different. So some alternatives to the three that I had just mentioned. It's worth checking out. It's a co-presentation between the CBS Career Team and also the Pre-Health Student Resource Center tomorrow at 11. On Wednesday, we are going to be inviting some alumni from CBS to talk with you about becoming a physician. So we have an event called So You Want to Be a Physician on October 14th at 4. You can register at the Z link on the slide. Also, I skipped this one, I didn't mean to, but on October 14th, earlier in the day at 11:30, I will be going through interviewing for health professional school. It's a hands-on workshop where you'll have a chance to practice some interview responses and learn what some common interview questions might be and how to prepare for the logistics of your interview. We'll also have a personal statement workshop on Thursday the 15th at 2. And then another alumni event this Friday at noon over the lunch hour, Beyond Medical School, exploring the wide world of healthcare careers. Again, it's another alumni networking event, and I encourage you to check out these Z links. And if you're interested, to register soon, as both of the alumni events are open only to a maximum of 16 students. But it'll be a great time for you to hear about how these people made decisions about their careers, what their careers are like, and then you'll have an opportunity to go into some breakout rooms with people as well to ask your specific questions. Okay, so to get on the agenda today, I'll be going over some of the application components for different kinds of health professional schools. I'll talk about how to select a program, so some of the factors that you might want to consider, and also a timeline for applying to school. So to start, you want to ask yourself, what is pre-health? Pre-health is really just not a major, but it's a clinically licensed career interest that relates to treating patients and usually requires an advanced degree. So I have several different kinds of health careers listed here. It usually requires either a master's degree or a doctoral degree, and you need to pass an exam in order to perform this kind of career. When we're thinking about health professional school, sometimes we don't know what health professional schools are really looking for, or we have an idea of what we think health professional schools are looking for. And every health professional school is different. But in general, most health professional admissions committees are really looking for empathic problem solvers who work well with other people and also who have a dedication to serve others. They would also like applicants to have patient care experience, and they're looking for people who are well prepared for school and well-rounded, and people who feel like they're confident that they've made the right career choice. So sometimes you might wonder, like, how do you make sure you're making an educated career choice? And we'll come back to that in just a minute. Okay, so you'll be asked many times when you're, before you apply to health professional school, and certainly as you're applying to health professional school, why do you want to be a pharmacist? Why do you want to be a doctor? Why do you want to be a dentist? So this type of question is really tied to what you know about the profession. And sometimes people will choose a profession based on reasoning that isn't necessarily wrong, but it might not be very substantial either. So answers like, well, my uncle is a dentist, or I've watched Grey's Anatomy, or it seems like fun. So those are some reasons, but it might be a little bit of a weak reason. So consider what you have done to learn about the profession and really validate that you have a genuine interest in it. As you respond to this question, either in your interviews or in your personal statements for health professional school, you want to try to avoid a cliche, such as, I'm applying to this program because I like to help people. And most likely you do, which is why you're interested in a health profession and a helping profession. But I would recommend that you avoid saying directly that you like to help people, but really reflect on why that is and give reasons why based on the different experiences that you've had, such as shadowing, volunteering, and some personal experience possibly. So here's some information for you to consider as you're thinking about a career fit for you. So it would be helpful if you can reflect upon some of these things. So what are you learning about yourself from the coursework, from your life experiences? What are you motivated to learn? And really, why do you want this particular career? Are you good at the classes that are necessary for a career in the health professions, which are generally science classes? Beyond earning the degree, what else do you hope to accomplish in your life? What's meaningful to you? What do you value? And what else might you enjoy doing aside from a health profession? I think that these are important questions to reflect upon in order to make sure that you really are entering a career that's going to be a very good fit for you. If you're thinking about exploring health careers, I mentioned earlier that we will have a session tomorrow about exploring different types of health careers, but I can recommend the explorehealthcareers.org website as an excellent resource. It includes information on almost 100 different healthcare careers with varying levels of education required. So if you're someone who's really exploring right now and are unsure about medical, dental, pharmacy, or one of those healthcare careers, you might want to give this a look. So let's move now into some of the application components for these different schools. So when an admissions committee for health professional school is evaluating candidates, they're looking at several different factors. And you may have heard of the term holistic admissions. And if you haven't, I'm going to describe a little bit what that means. So the components of an application are typically going to be your academic record, which includes your GRE, any test scores like the MCAT, or GRE or anything that you would need in order to get into that school, some requirements. They're also going to be looking at your experiences. And those can be both clinical experiences and working directly with patients. It could be research experience. It could be other non-clinical kinds of experiences. And I'm going to go through that in a little bit, like what exactly these experiences could be. You'll also be submitting letters of recommendation, a personal statement or a letter of interest, and then you'll have the interview for your application. So let's get into the different elements here that I just described. So what I have here is some 2020 data from the University of Minnesota and some of the health professional programs that you might be exploring right now. So you can see in one column, there are the number of applications that were received for the 2020 beginning class. And then you can see the number of people who matriculated into the program. So when we look at this, sometimes it can be kind of shocking to see, oh, wow, there are close to 5,000 people who applied to the University of Minnesota Medical School in the Twin Cities with an entering class of 175 people. So after you panic, and I hope you don't, I'm not showing this so that you do panic, but it's just to give you kind of a realistic perspective about what you might be wanting to focus on if you're interested in one of these health professions on this particular slide. And really to ask yourself, how can I be the best possible applicant before I submit my application? Or when even is the best time, knowing that it can be a pretty competitive process to be accepted. So here's a little bit more about these components of your application. So we have three different things on a scale here. In the middle, we have your academic metrics, that's your GPA and your test scores. Then we have personal attributes or characteristics of your personality and your character. And then on the other side, some relevant experiences. So let's get into this in more detail. In terms of academic preparation, your major is important, but it really is not as critical as the prerequisite courses that are required for whatever program that you're looking for. So it varies by program, but most programs will require basic scientific preparation. The GPA is important, and especially looking at something called BPCM or BCP, which stands for Biology, Physics, Chemistry, and Math, and Biology, Chemistry, and Physics. And depending on your program, they may be evaluating these courses more heavily. Okay, so some programs may really be looking at the BPCM, other programs will look more closely at BCP. And what is your GPA in those particular science courses? Admissions committees also look at any classes that you have retaken. So I have had some students who may not have done as well in a chemistry class along the way, and so they opt to retake that class. And are you improving your grade the second time around? So that's evaluated. Looking at upward trends in your GPA. So as you go through college, is your GPA increasing, or is it decreasing, or is it staying the same? And then there's the importance of the last 60 credits on your transcript as well, and your GPA in terms of those credits. I also encourage you to look at the Aamc Table 24. And again, these slides are going to be made available to you on the CBS Student Services website. So you'll be able to go directly to this table, but it's essentially a list of different health professional schools, well, medical schools in particular, and the different kinds of information about how many people apply, how many people are accepted. Programs will also be looking at any kind of research or lab experience that you have. Research experience is not required for many medical schools. It is required for some. You will need to check with your medical schools to learn if it's required or not. And then again, your standardized test scores, MCAT, DAT, GRE, et cetera, that's also evidence of your academic preparation for health professional school. Okay, so let's look at the mean national GPA for MD programs. So on this chart, or on this graph, you can see that there's the biology, chemistry, physics and math GPA, and then your cumulative GPA. So you can see here that on the lower graph, in terms of applicants, the GPA cumulative was a little over a 3.5. For students who are accepted and matriculated, it's a little over a 3.7. Now, I don't want that to dissuade anyone here who may have less than a 3.5 or a 3.7. This is just really just the mean. So many schools will look at the whole person, and the range of GPAs is really what you want to look at when you're looking at medical schools. Some medical schools will accept people with a 3.0 at the low end of the range, all the way up to a 4.0. But this is just an average that I wanted to point out. And if you wanted to look in depth in terms of medical school admissions requirements, there is a table, or not a table, but actually a resource on the AAMC website. It's called MSAR, Medical School Admissions Requirements, and you're able to search for medical schools here and look in terms of which medical school, and the GPA, the number of enrollees, tuition, all sorts of information for medical schools. You can access this by going to the AAMC website and looking at the MSAR data. You are able to pay for a subscription to have access to this resource. It's a very small fee. You can also work with a career coach like me in CBS, and we can help you access this data as well. I also wanted to show this for students who are interested in dental school. The ADA also has a a resource on their website for students who are considering dental schools and wondering about some of the metrics there and wondering just where the programs are for dental school. So you're welcome to check out this resource as well to search for different dental programs. So aside from your academic metrics, medical schools will also be looking at something called your personal attributes. So the personal attributes are also tied to the AAMC competencies, and I have a link on the bottom of this slide that you can explore. It's the core competencies for entering medical students. So here are just some of the personal attributes that admissions committees would be looking for, and this applies to dental school and pharmacy as well. So adaptability, critical thinking, how you communicate, your maturity level, your work habits, cultural competence, your motivation for the career, resilience, empathy, etc. Those are just some of them. So as you're thinking about yourself and your preparation, I think it's helpful to remember these core competencies and try to ask yourself, how can I demonstrate adaptability? Or how have I demonstrated adaptability? Through what activity? Through what experience? Or you may look at this list and you might say, I haven't really had an opportunity to develop leadership. So if that's an important component of an application for a health professional school, what might I be doing in the next year, the next 2 years to gain some leadership experience? Knowing that that is something that you can talk about in your personal statement for medical school, on your application for school, etc. So be thinking about these personal attributes as you're going forward. Relevant experience is also something that is going to be important if you're applying to medical, dental, or pharmacy school. And by relevant experience, we're thinking about, one, experience in a healthcare setting. Some of that could be shadowing or volunteerism or working, participation in leadership or volunteer organizations, the distance traveled or some obstacles that you've overcome. So those can be some compelling, there's some compelling information there that could come out in your personal statement. So what have you had to overcome? What are some of the hardships or challenges that you faced and you've been successful in overcoming? Also note that some programs do require a minimum number of hours of direct patient care experience, PT, that's physical therapy, PA, physician assistant, those kinds of things. So you'll want to be able to understand the number of hours that are needed for a particular application. Also, I have a note here to keep a journal of your experiences. And this will help you as you're going through writing a personal statement and when you're answering interview questions for both your primary interview and then also some supplemental essays that are usually a required part of the admissions process. Keep a journal of your experiences with some of the challenges that you faced, some of the successes that you've had, etc. And then another note on experience. I think it's really helpful to think broadly about what experience means. So certainly some people will have paid experience in a clinical setting, such as being a personal care attendant or an EMT, a certified nursing attendant, a scribe, a pharmacy tech, those kinds of careers or jobs that really give valuable clinical experience for students before they apply. So that's paid experience, but then also think about your research experience or your lab experience. You might think about study abroad if you had a chance to do that, or if you will have a chance to do that in the future, and what you learn from that study abroad experience and being in another culture. And then you might also think about just reading things. So I have 2 books here that are really interesting related to the healthcare profession or different healthcare professions. And even if you just would read some things and keep up with what's going on in health professions and some interesting issues that are facing your health profession, that's going to be experience that you can discuss certainly in an interview and then also possibly in your personal statement for school. And a note here for people who are thinking about dental school. Dental school and being a dentist requires manual dexterity. So having fingers that work well for fine motor skills. So I have some images here of, knitting, drawing, piano playing, sculpture, those kinds of things can help you to develop some of that manual dexterity that would, assist you in becoming a good dentist, because you need to have some of those skills. So you may want to work on developing some of those skills as well while you're in school. Other kind of experience too, like I've talked a lot about clinical experience already, so working with patients, but non-clinical settings can be really important too. There is a section called Build Your Student Portfolio on the Pre-Health Student Resource Center website. And there are health action plans there that you're able to look at, and you can really, get a sense as you enter in information about what you've already done and some activities that you've already done. You'll also be able to plan ahead. So what activities do you want to add? What experiences do you want to add before you apply to health professional school? Shadowing can be another really important component of your health professional journey. And many health professional schools would say that they want you to have shadowing experience. For some schools, they require or really want you to have experience shadowing the same physician or dentist for a lot of hours. So you want to have a breadth of experience, so shadow people in all kinds of different clinics in different settings, but also take a little bit of a deeper dive and shadow someone repeatedly. So example, I have a note here that the U of M School of Dentistry requires 50 shadowing hours before students might apply to that program. And then I have a link here to a program called Web Shadowers LLC. And this resource was put together by 2 medical students, I think it's at the University of Florida, who understand that shadowing is not possible at this moment, or it's very limited at this moment. And so they have virtual shadowing experiences that are free and open to anyone. And so there is a link there if you're interested in participating in something like that in a virtual manner. And also, if you're not able to shadow right now, think about something called informational interviewing. So that's kind of an interview where you can sit down face-to-face with a health professional or virtually via Zoom or Google Hangout and ask them some questions about their career and really learn from them about how they made a decision about their career, what is a day-to-day like for them, what do they like about being a dentist, what are the challenges of dentistry, and they might be able to walk you through even some cases that they have encountered so that even though you can't shadow directly, you're still able to learn a little bit from them about what that career is like. I also have some links here as well for volunteerism. So engage.umn.edu and the third bullet there, servicelearning.umn.edu. Those are both university resources that have information about how to get involved in volunteerism. There are virtual volunteer opportunities as well. And then one thing that I did want to show you all here is the NAAHP, which is the National Association for Advisors of Health Professions, put together a list of resources called Ideas for Pre-Health Students During COVID-19. And there are some really good ideas here for you to look at in terms of how to volunteer virtually, how to network with professionals, how to research schools, journaling, engage in online learning. So all kinds of ideas, given that we're not able to really have a lot of in-person experiences in healthcare settings, or as many as we would like at this moment. So I encourage you to check that out. Okay. Okay. There's also, so there are some enrichment programs that I wanted to highlight as well that are intended to support students from backgrounds that are traditionally underrepresented in health professions. The Pre-Health Student Resource Center here at the U does have a program called the Health Profession Pathway Initiative. And then there's also something called the Summer Health Professions Education Program, or SHPEP. There are many locations around the US, and I encourage you to check that out as an additional kind of enrichment for you before you're applying to medical school. Okay, so going on to the other piece. So what other things are required for your application to health professional school? Letters of recommendation. And the ideas that are listed on the slide here are just ideas. There's certainly some other types of people who might be able to comment on your preparation for health professional school, but we're thinking about science professors that are usually helpful, possibly a non-science professor. If you are involved in research, maybe your primary investigator or a PhD student who you might work with in the lab, certainly a medical professional in the field that you'd like to enter, or a volunteer coordinator if you have had some volunteering experience. You also will need to write a personal statement, which I've mentioned many times already. And essentially the personal statement will answer the question of why do you want to be whatever it is you want to be. A couple of resources that you might want to consider as you're writing your personal statement. First of all, spend a lot of time on this. And, depending on how confident you are in your writing skills, you may want to spend 2 months on your personal statement. You may want to spend longer than that. If you're very confident, maybe you'll be able to just write a couple of revisions, but know that usually you'll be writing many revisions of your personal statement. And I would recommend sharing your personal statement drafts with many people. The Pre-Health Student Resource Center does have a class called AHS 2400. It's writing the personal statement. And they recommend that you might take this class the semester before you apply. So the semester before you actually submit your application for health professional school. There is also an online workshop in writing the personal statement on the Pre-Health Student Resource Center website. You can visit the Writing Center on campus to get some feedback on your statement. Of course, you can always go and talk with CBS Career Coach, me or my colleagues, and we're happy to give you some feedback. And again, this week we will be having a personal statement workshop as part of our pre-health kickoff week. One note too, for people who are interested in the dual program for MD, PhD, I have a note here that most of these programs participate in a centralized application service, the very same one that medical students would be applying through. There are 2 additional essays though, beyond the personal statement. So another essay that you would need to write is a reason why you're applying to an MD, PhD program, and then also a description of your research experience. And for people interested in MD, PhD, you want to make sure that at least one of your letters of recommendation comes from your research mentor. If you have 2 research letters, that's even better. Okay. And then just a note on reflection. So I have a quote here from the former director of admissions at the University of Minnesota Medical School, Teresa Baltru. And what Teresa says is that self-reflection is an essential practice for medical school applicants. A reflective applicants present a stronger application profile as demonstrated by thoughtful and well-written personal statement, their list of experiences, and the secondary or supplemental application. What Teresa is referring to are the secondary essays that people who are applying to medical school need to write. So you want to be reflecting after all of the different experiences you have. So think about your volunteerism and reflect on how has this opportunity helped me to grow as someone who will be successful in my profession. Think back to those competencies that I highlighted in the beginning of this presentation and try to ask yourself how a particular activity helped you to meet those competencies. Okay, so reflect continually. And again, I said it before, but keep a journal of your experiences. And I also have another quote here from Teresa. By reflecting on past experiences and situations, medical school applicants can articulate how those experiences help them further develop their passion and interest in medicine on the application and also during the interview process. And this is the director of the medical school or the former director, but this really applies to any health professional program that you might be considering applying to. So I just want to reiterate, which applicant will you be? Sometimes we hear as we're applying to medical school or pharmacy school or dental school, don't be a checklist applicant, but be a 3D or an evolving applicant. So what does that mean? So a checklist applicant is someone who follows a real formula, meaning they think they need research experience, they think that they need clinical experience, and they're thinking they have to check off some boxes for the different experiences that they need. Their focus is on getting into medical school, and their choice of major might be determined by a desire to please admissions committees. So someone who's more of an evolving or 3D applicant kind of creates their own formula. And the focus is on really becoming an excellent healthcare professional. Their choice of major might reflect genuine intellectual curiosity and passion. So what you may not know is that a science major is not required to go to any of these schools. Prerequisite courses need to be met, and those are usually science courses, or there are almost always some science there. But medical schools, dental schools, and pharmacy schools are really looking for applicants to be themselves. So rather than checking off boxes, try to ask yourself, what am I genuinely interested in? What do I want to explore? What do I want to study? Where do I want to volunteer? What matters to me? And make your decision and go toward that, because then you'll have some genuine and authentic experiences that fit with your values, and you'll be able to express how your activities have influenced you and helped you to become an excellent applicant for health professional school. So let's get into some of the logistics now. So thinking about where to apply. For students in CBS, the top schools of interest are the University of Minnesota Twin Cities, Duluth, Madison, Medical College of Wisconsin, Mayo Clinic, Iowa, North Dakota, South Dakota, and also schools in the Chicago area. So you might want to consider a lot of different factors. Students that I work with will typically apply to anywhere from 10 to 20 medical schools. But how many you apply to really depends on a lot of these factors. You don't have to apply to that many schools. First, you might consider the mission of the school and how that mission might be reflected in your values. Location is a huge thing to consider in terms of where you can live, where you want to live. Some people have family considerations and they need to stay close to home. Other people are ready to leave and they have a desire to go elsewhere for school to explore. The cost can certainly be a factor on where you decide to apply. Also, the percent of applicants who apply to the health professional program and the percent who are accepted. And a general rule of thumb is to, when you're thinking about schools to apply to, think about some schools where that are kind of a reach for you, where it may be more competitive, but you're really interested in attending that school. Then you might also have some schools that are a little bit more reasonable or realistic for you in terms of your acceptance. Also think about whether or not the schools you're interested in have an in-state versus out-of-state preference. And what that means is some schools do need to actually accept more students who are considered in-state. Those are usually public universities who need to do that because they're given some money from the state, and that money is allocated, toward recruiting students who are in-state. Private universities, it's a little bit different. They can accept students from anywhere because they're not tied to that state money. You might also think about schools that have something called combined degree programs. So some schools you'll be able to get a medical degree and a degree of public health at the same time, your Master of Public Health. So think about what is important to you and if you want to look at some dual degree programs. You might also want to look at resident tuition rates, and that ties into the cost, the third bullet here. So not infrequently, it's cheaper to go to a school, or the tuition is lower if you're an in-state resident. You might also want to look at the diversity of the student body and how important that is to you. And if you want to have that experience, or the kinds of clinical experience you might have, treating people from diverse backgrounds during your practical experience. Also look at different kinds of opportunities with your program. So is there a service component? Is there an opportunity to work in rural clinics? Is there a research piece to your program? Does your program offer a chance to study abroad at the same time as you're going through your education? And then also you might be considering rankings, like how how competitive is this particular program in school, and that may be an important value for you. What I have here on this slide is a bit about school directories and how to find out about all the different kinds of health professional programs related to medical, dental, and pharmacy. So the AAMC, the Association of American Medical Colleges, has a directory of schools that are focused on MD, and then also osteopathic medical schools. The Council of Dental Accreditation also has a directory, and then pharmacy also has a directory. So you're able to really get a sense of where are all the programs, and then start making your list about the types of programs that you might be very interested in. So when is the best time to apply? And I'm asked a lot in career about when should I apply? When should I do this? And the answer that I sometimes give is you want to be the best possible candidate before you apply. The average age of someone who applies to medical school or someone who enters medical school is 24, simply because it's often helpful to take a gap year or two or even more in order to have some of these experiences that help to prepare you and make you the best possible candidate. So there's no rush in terms of applying. You want to make sure that you're ready and that you're very certain that you want to go into this profession before you start medical school. A bit about the timeline for applying. For medical, dental school and pharmacy school application, I'm sorry, not pharmacy, medical, dental, DO schools, application systems open in May, and that is the same for this year as well. Submission of your application materials into a centralized application service usually begins in late May to early June for people who are applying for graduate programs that will result in an MD, an OD, MD, PhD, and DO. The Pharmd Cycle is a little bit different. It begins in mid-July. And it runs through the end of June of the next year. So for example, if you're interested in applying to pharmacy school with a start date of September 2021, that application opened this past July and it's still open. There are typically secondary or supplementary applications. So once you submit your materials for health professional school, you're given your schools, like the select schools that you would like to apply to, will then send you some secondary essays that you need to complete, usually within about a week or two of receiving them. And they're typically brief essays, but that's another component of the timeline. Your interviews for these programs will typically start in late summer, so August, and go through fall and early winter. And that would be for the year before you start. And it's normally a rolling admissions process. So there is an advantage to you submitting your application materials right away because they'll be evaluated by the admissions committees, in the order that they're received. Here's a note again on the primary application services. So there's a lot of letters here. These just stand for the different kinds of centralized application services where you will be submitting your application. There are different sections in the centralized application. There's some identifying information, which means, who are you, name, address, and things like that. The schools you've attended for your undergraduate education, biographical information, the classes that you've taken, your work or activities, letters of evaluation or letters of recommendation. Then you can select which programs or schools you're applying to. You can attach your personal statement or essays, and then there's also a place where you would give information about your MCAT score or your DAT score. Before we end here, and there will be a chance for you to ask some questions in a minute, so if you do have questions about anything, now would be a great time to put that in the Q&A section. But one excellent resource that we have on campus that I've mentioned several times is the Pre-Health Student Resource Center. The Pre-Health Student Resource Center has many online workshops related to becoming a health professional and walking you through the process. They have detailed action plans for several different healthcare careers, from allopathic medicine all the way through veterinary medicine. And then they offer credit courses as well related to becoming exploring the career and becoming a competitive applicant. Then, of course, we also have your CBS Career Team. So you can schedule an appointment with me or my colleague, Mary Shannon Bocock, at the link that's on the slide here. And we also have many services available, pre-health career exploration. You can come in and do a mock interview with one of us. We can look over your application or talk about your application and answer your questions. We can definitely look at your personal statement and a resume if one is required for your application. And we can talk with you about how to plan for a gap year or two and what you might do in those years in order to become very competitive. And then also just looking for all sorts of different experiences. So that is the end of my slides. So I'd like to be able to answer some of your Q&A now. Okay, so the question answered, when is a proper time to shadow? Anytime in college, or more so when we get more knowledge of intermediate or professional medical classes? So anytime is a great time to shadow. I think shadowing is not only for your application, like a requirement of your application, but it also helps you to explore whether or not that career is going to be a fit for you. So I think it's helpful to actually make that sometimes your first step, in before you even decide what career you want to go into. It's helpful to talk with some people who are in that career. And again, shadowing is part of that, but it can also be an informal conversation with a family member who may be a health professional, or it could be something that's more formal that you set up, like an informational interview with a doctor or a pharmacist. CBS Career has resources where we can help you explore who you might reach out to. We've got a strong alumni network at the University of Minnesota, and we can help you learn how to contact some of those people. Okay, then another question, how important is that upward GPA trend that you were talking about? What if my GPA stays the same? That's a great question, and I know GPA is a concern of a lot of students. The GPA is, again, like I said, one factor. So if your GPA stays the same, that's not necessarily a bad thing. You also then want to think about all those other components, okay? Knowing that GPA is just a part of it, how much clinical experience do you have? How much volunteerism have you been able to accumulate? And sometimes, the scale will tip in your favor, I would say, if you have a lot of those experiences, even though your GPA has stayed the same. So you're busy college students. I know from conversations that I have with you coming into my office. So there isn't always a lot of, you're busy. There's not a lot of time to do everything. So even if your GPA does stay the same, you want to think about then the whole picture, all those activities, all those experiences that you've had, and be able to really articulate what all of this means in terms of your desire or your preparation to enter the healthcare profession. And you would do that in your personal statement, and then certainly in your interviews as well. Okay, so I'll just wait another few seconds to see if anyone has any other questions. Okay, well, that looks like all the questions that have come in. Please make an appointment to talk to a CBS career coach. I'd love to help you with your own personal situation and answer your own distinct questions that you have. I thank you for being here today, and I hope that you are able to join us for the other events that we have going on here in CBS for Pre-Health Career Week. Thanks.